chapter, we're going to discuss different aspects of therapy. I'm your guest lecturer, Donna Shu. I'd like to start off with a little humorous cartoon. So how long have you wanted to be a therapist? Well, that's what I would like to ask you. Ed was in therapy for believing he was a therapist. I'd like to start off by saying there is effective treatments for various mental health concerns. Psychotherapy can restore hope, control, and help the person in their journey of recovery. What you may not know are there are many different kinds of therapy. This slide is just a summary of different kinds of approaches, some of the main families. Psychotherapy is given by a trained therapist to help someone overcome the difficulties that they're having or to achieve personal growth. Biomedical therapies are some that you might be familiar with. So we're having treatments such as medications or other biological treatments, and you'll be looking at those in your textbook. And another approach is called an eclectic approach. In other words, we use multiple different kinds of approaches to help a person. And in fact, usually it is not one size fits all. Treatment is individualized for every single person. And many times we draw from different approaches, such as a person might need a medication therapy, they might need family supports, and also maybe individual therapy as well. I really like this slide. I think it's the kind of the essence of therapy. A therapist gives hope, and I cannot overemphasize that. Hope for people when you're not feeling the best. Usually, people come through the door when they're feeling pretty bad, and so now we can, say, hey, you know what? Even though you're feeling bad, we can plan ahead. We can look toward the future. You're not here alone. We can take steps to get to the bottom of this and move forward. It helps you redefine your perspective of the world and see things from different ways. A therapist is trained to help you to do that. And also it gives you that trust and caring relationship that you can feel free to bond with that other person and work through the difficult process of healing. Many times people wonder, hey, is this really effective? Does therapy work? And we have done meta-analysis of various types of therapy, and we can say yes, for the most part therapy is very effective. Not just based on people's testimonials or, saying, okay, I think this is awesome, but actually doing research to find out that people actually do improve more quickly with less chance of relapse when they have a therapy approach. Now, I like to say that treatment needs to be holistic. In other words, we need to have healthy thought process, healthy bodies, and even spirituality may be included in that. Healthy nutrition. So we need to look at a wide range of ways to help. Our bodies are actually designed for physical and social engagement. And if you look back, I like this slide for the picture, we were built to hunt, gather, and work together in groups to survive. In the past, we needed to do that simply to live in a very difficult world. Today, we want to emphasize total health. So your treatment program may involve education about your nutrition. It may involve information about adequate sleep hygiene. You may get information about exercise. If you notice, there's social engagement, and I've talked about that a number of times already. Research shows that if you have social networks, you will do better. Even ways to help change your thinking so that you're not going over things in your mind over and over again. They call that rumination. So we can give you techniques to help change your thinking and actually give you homework on how to manage your thinking so that you can have positive affirmations for yourself and also interpret things differently in a more positive light. How can we prevent psychological problems from happening in the first place? And when they do happen, how can we promote resilience? In other words, the ability to overcome trauma and stress. Well, what we need to do is help promote environments that are more nurturing, that foster your growth and foster self-confidence. And providing and finding those social networks can help you build in protective factors. If you remember from our prior chapter, there were risk factors and protective factors. This is a huge one that can help you have the resilience to overcome many things in your life. When we talk about resilience, that also means that we have developed a pattern of coping skills. And the more coping skills that you have, the stronger your resilience. The ability to redefine experiences, the ability to talk about things, the ability to even write about your experiences can help you. Resilience can be seen in people that have coped from serious traumas, such as individuals, from 9/11, people who have faced major disability, people who have survived, trauma from war. You will see that a lot of the therapy revolves on making people aware of their negative thinking and replacing it with new ways of thinking, and to actually practice behaviors in everyday settings. Also, self-help groups are very helpful as well. Again, that social support can build resilience. I hope this helps you with a little overview about the importance of psychotherapy and other therapy approaches. And I encourage you to read the rest of the chapter to help you evaluate the psychotherapies and understand the differences between them.